So the issue really, because I've heard you use fiscal space three times, the issue really is about fiscal space, not because we have no need of them in the public sector.
I'm coming there.
Okay.
So it's one, fiscal space, ability to pay, and two, physical, not now FISCL,
PH.
positions present in the hospitals. So the spaces to be filled, let's say by physiotherapists. The number of physiotherapists being trained now across Ghana, you can't even put all of them in facilities, but you can put some. So I think, to be honest,
so sometimes when we hear,
giving them clearance and all that. And even when you came, you were giving clearance.
Yes,
and then by 2019,
that's why
what accounted for
that's
that?
Why,
because the problem started from 2019. Even in 2017, there wasn't a problem. 2018, there wasn't a problem. So 2019,
I should have lost
you said fiscal space.
No,
It's mentioned there. So okay, what
fiscal
I wanted
space
to,
is
what I
split.
wanted
I don't
to,
understand.
money.
they don't have money.
Money. Is that the numbers?
Okay, you don't have
The
money.
numbers will have a
you
reflection.
don't-
But they are
of
not
the-
many.
No, you don't get
But now that you have discovered polio, wild polio and all that, don't you think you need their services?
So
if anybody creates the impression that clearance is not being given, it's not true.
No, I'm talking about these allied people.
When I refer to fiscal space, I mean the money to absorb all. When I say all, the nurses we are training averaging now in Ghana a year is about 55,000.
So we are talking
in
about
the
nurses.
in the
You don't
public,
get what
We are
I'm
not
saying.
saying absorb all. At least
It's a discussion.
2019.
No, it's a discussion.
No, people will crack as I'm
Allied Health, they are requesting.
okay, let me understand something.
Yeah.
The 55,000. Are you talking about those who are in the public sector?
All.
So public and private.
Yes, private. It's a country. We are training.
Yeah, but you.
Oh, but you're talking, that's the total population.
I'm talking about nurses, not even allied.
Yeah, but
why are you talking about necessary?
But,
We are talking
okay,
about
we know
allied.
that it is those in the public sector
Yeah.
who government has a certain responsibility to absorb into the public space. For those who attend the private institutions, government is not under obligations.
But you see, that's why we have to have a holistic discussion. It helps us understand what is happening.
Yes.
My point is that in the past, anyone who went through, mostly we didn't even have private institutions, most were government.
Yes.
It was tradition that all were absorbed. Sammy, if you come so that you understand the discussion.
In fact, we were enticing people.
Okay, you finish.
Yes.
We were enticing people.
Exactly.
Yeah.
But as we move on, the numbers that are being trained, an organization is put up, it's a private organization. They are training, let's say, physiotherapists. They have all the facilities.
They are certified.
Certified. They are training, let's say, twice what government is training. If everyone who qualifies as a physiotherapist, because it's a health worker, has the thinking that the destination is government space, you know what I'm saying? There's a problem. Because the numbers that they are training, if you even distribute them into the facilities, they are more than the facilities. You don't have patience. You see, if
But
you
Wunya
are,
is still campaigning. No? Do you listen to him on the
No,
campaign
you
talk?
let him finish.
No.
Just take note. Let him finish.
So, what we have to discuss, and this is the solution. So, what are the things you put in place so that the market can absorb these people? We don't have a lot of rehabilitative centers. Now in Ghana, you have a lot of people because of modern medicine who are stroke survivors. Doc, what you encourage, and this is where leadership comes in. You have to encourage both government and private to invest into rehabilitative centers. People call me sometimes, oh, where can I have a physio? If you have a private physio center, doc, it can employ, let's say, 50 physiotherapists. Maybe more than even Kolebu would employ. So, teachers,
Doc,
let
what's their
me
population?
learn.
No, just a question. The allied professional health workers, what's the number?
I've told you, you have over 15 branches. Audiologists, radiotherapists, how do you call it?
Lab
sonographers. All trained. It's huge. Yes.
In the public institutions.
No, some are trained in private.
No, what I'm saying is that for those who have sent this message, I'm sure there are those who were trained in the public.
No, you see, me, I'm careful with my words. I don't want to say if someone going to misquote me. The Okoboy said, if you are trained in public, it doesn't mean you automatically be absorbed. I don't want to say that. But we are having a broad discussion. Doc, you know something? I don't want to politicize it. If you ask them, please, if you ask them,
2020 figure.
if you ask the allied people from 2009 to 2016, before we came, the numbers that were trained versus the numbers that were absorbed. If you look at the percentages, I will not be surprised that the percentage we have absorbed now is even better than the past. But that will not solve the problem. Listen, I like holistic discussion. I want solutions. I'm telling you that we have to create the space, the market, to absorb this.
Suggesting that we do not have
the
need.
It's not true.
Today.
Hold on, no. It's just a conversation. This one is not debate.
All right,
so you are a minister of health. Relax. Look, in the Tyne district in my region, the whole Tyne hospital that the NDC built, they don't have disease control officers. They don't have nutrition health information officers. If you go to German North, Doma, German South, which borders Ivory Coast, the disease control officers there in charge of surveillance activities are just 8 in number. And I can go on and on. Look, there is a need, serious need, especially now that you are even talking about polio, and there is a need, a significant need for these people. Who are the people we are talking about? Health promotion officers, sonographer, radiographer, physiotherapist, disease control officer, environmental health officer, audiologist, community health officer, dental laboratory sciences. We need them. And their numbers are very low. I think that you just went to the Ministry of Health, okay? You were not there when that 2019, 2020, 2021, 2022
but
problem
he was
occurred.
deputy minister at a point.
At some point, but he was not the man. Yes, I mean, he's been part of the whole government, but at least what I'm trying to say is that he was not the Minister of Health. So, instead of trying to explain away serious matters,
it's not away.
You are now going to. You now want to have a holistic discussion with people who have something to provide. My advice, I'm ending so that you come.
Okay.
My advice is that accept responsibility, give hope, go as minister, demand a meeting with the president, go and put before the president the plight of these people, these young people who have gone to school. They are the hope of their families, but today their hopes have been dashed and they are sitting home. And tell your government to prioritize their needs, cut down the waste. The monies you wasted on Sputnik V vaccines, paying some fraudulent sheikhs in Dubai $19 when we could have bought that from the Russians at $10 per dose. Okay, something that Parliament has established to be fraudulent and all that. All the monies we wasted on COVID-19 expenditure, which you gave to your party apparatchiks like Biscuit, if you prioritize the needs of people who really need these funds, we will not be here. So stop making excuses. You are a public officer. We pay you with our taxes. The problem is that for 5 years, 2019 till now, people who are supposed to be posted by your government are still sitting home. Just give them hope and go and do the needful. And the needful is about setting your priorities right. Cut down on the corruption, cut down on the waste, and I am telling you, you'll be able to find money to pay them. How many are there? Just a few people. Don't say that we don't have the space. There is this. We need more of these allied professional health workers. Don't say we don't have the money. The money is there. Even as we speak today, people are wasting money on many useless things in your government. Look, just set your priorities right.
The reason why NDC will make noise about health insurance, they will come into office and then for a whole year, they've not paid hospitals. MPP will come to office. They will make noise about health insurance and we have challenges and gains. Look, it's because people like my brother Sami, when we have a discussion, they are only interested in the immediate political gains.
What political gain?
Look, me,
advocating for them.
In my public life, I don't want to be part of a system that has the same issues over 30 years. It means I'm a failure. Okay? Every discussion can be treated at the top and into details. I have the details here. I will give you a breakdown of those we've employed, even allied people. But, look, before Akufo-Addo became president, all health workers that were trained in Ghana, with all due respect, President Mahama, former President Mahama, could not even admit 40% of them. Dr. Randy, I want Sami to know that all health workers, pharmacists, until Akufo-Addo came for about like 7-8 years, all pharmacists trained in tech.
There was no backlog of allied professional workers when John Mahama was leaving office. All of them had been boosted.
I want the viewer to appreciate the topic.
The nurses we
okay, look, I'm saying that I'm not here to score immediate political gains. I'm here to let Ghanaians appreciate what the problem is and how we can solve it. I'm saying that in the past, all health workers that were trained were absorbed. As populations increase in terms of the training, you can't absorb all in the public space. It doesn't mean you don't absorb any, please. And I've not said here that we don't have need of them. I'll show you those that we've employed.
Since 2019?
Oh, please. I'll give you the details. I have the details here.
Okay.
From my HR, I'll give you all the details.
Okay.
So the point I'm making is that, even if, and you see the way he's talking, it's because he doesn't understand it. He said there are 400 of them.
No, the 2020 batch.
Correct.
465.
But when you go and check,
yes,
you have years, those who have been trained. And with all due respect, I'll not even be surprised if you check, if you open your lives. There are people who were trained before Kufuor came who are still not employed. So the point I'm making is that it's a similar thing that happened in education. I had a discussion with Dr. Napo, and he said, because most...
Don't tell us about the problem.
Let's understand.
You are being paid with our taxes to solve problems, not to lecture us on the problem.
Sammy, but this is unfair. Let him answer. Let him answer. Sammy, it's very unfair. You cannot determine for him.
Yes, I'm sorry. So all teacher trainees, because they were receiving allowance, had this thinking that because you are on a government, and I learned even those times, the number you use for the allowance is the same number you transition to controller. So the thinking was that when I'm trained in NSC training, automatically I'm supposed to be a staff of the state.
Yeah, because you are incentivizing them to go for that training. No. Because you, by incentivizing them, you are saying that I have a lack.
No, good.
So I am encouraging people to go into this area.
No,
that is why I'm giving this extra incentive.
But
so it is only consequential.
Yeah, no. Since they transitioned and all the products became degree holders. Now they are thinking a mindset is similar to those who go and do degrees at Cape Coast, where they know that they are for the market. The market can be private or public. So in this
was the argument that came on the issue of taking out allowances. And yet we politicize it.
Correct. That's what I'm saying.
Now you see where we are.
That's what I'm saying that. Let me think about joy. When I get me fair discussion,
please.
When I
say I'm not being fair. The man is not treated.
Uban almost 10 years never no.
You are not teaching me.
So see, Dr. Radi was making the point that it was such thinking, the one I spoke about the teacher trainings, that when the NDC said let's remove nursing training allowance, so that the people, even that one,
the teacher training.
So, yes, the teacher training. Yes, but for the nursing, they spoke about removing the allowance. It was loan. Yeah. It was loan that was spoken about, but not to make it degree passing. But Doc, for the year 2018, medical officers that were absorbed by the state. Oh, I'm giving you the breakdown.
The goalposts. We are talking about allied professional health.
I'll mention allied.
Raise the issue.
So that you know that under Kufuor they've taken some.
You are no longer a communicator. Yes. You are Minister of Health.
Oh, I'm giving you data.
Address the issue on the table.
No. Medical officers. 2018, 742. Let me come. So you have house officers, specialists, physician assistants, nurses, diploma nurses and midwives, degree, medical herbalists, support staff, and allied health. No, allied health professionals.
How many? Give us a number.
2019, 992, please. 992 allied health staff were taken to 2019. Yes. 992.
2020.
Yes.
2019.
Yes.
What about 2020?
They were which batch? That 992, I'm sure will be the 2018 batch, right?
2020. 2018 will be employed in 2019.
Yes.
Yeah, Doc, so I'm talking about...
Doc, 2020, 4,146 allied health professionals.
2021.
2021, 2,331.
Which batches were these?
Doc,
these are bulk figures. The total figures, for example, if you have half of the 2020 figure being employed in 2021, it tells you
but
that obviously
is it true? I'm just putting before you the complaints I've got. Is it true that the 2019 batch, 2020 batch, 2021, 2022, 2023 batches are of allied professional health workers are still home? Is that true?
What he's not having.
No, I'm asking.
You are not patient. Even in a discussion, you are not patient.
True or false?
See, I'm giving you some figures. You are not ready for a discussion. Please, the viewer.
I want you to educate me. You are the Minister of Health. I'm asking you a direct question. Is it true or false?
Allow him to
when you even ask the question, you have, forgive me for using the word, the mind you have is prejudice. There's a particular thing, so I'm not even ready for a healthy discussion. Please.
Doc, let's proceed.
You see that
he's not ready to
please,
answer the question.
If you add the numbers I've mentioned, when you add 4,000, 992 to 4,146 to 2021, 2,311. No, you can hit about 7 or 8,000. What Sami must be interested in, and this is what the viewer must know. Although you've absorbed, let's say, 8,000, it's possible that the train number you have is 50,000.
Yes.
No, the question is that, this is an honest question.
Yes.
If tomorrow Mahama becomes president, is Mahama going to give employment to all the 50,000? No, two things. We might need more.
Oh, you did not answer. You have asked the question. Let me answer. Because I asked you a simple question.
Sami, let him finish. I give you the opportunity. Don't worry. Let him finish. Yeah.
No, the number of allied health workers we need in the facilities might be more than we have now. MPP government has taken some. We'll make the effort to take more. But I will make a point here, and anybody can note it down. No president in the next 15, 20 years, the numbers of health professionals who are checking out can absorb all in the public sector. What we have to look at, probably, is the percentages of those trained that are absorbed in the public sector.
So let me ask this question.
Yes.
We cannot absorb them in the public sector because there's no space, or because we do not have
two things.
We do not have the financial.
No, two things.
Yes.
If you absorb all there will be more than the spaces you have in the public sector. That's one.
Okay.
And two, the numbers you need for the correct ratio. The state has absorbed some and not all the numbers, of course, because of fiscal.
So help me with this.
Yeah.
We hear that there is a doctor-patient ratio.
Yes.
And there is a recommended ratio.
Yes.
And then we are giving the Ghana ratio.
Yes.
Now, whether it is for doctors,
yes,
pharmacists, yes, nurses, I'm sure it will be the same for the allied health workers. Ghana has never been close.
Yes.
Let me not say never, but I'm saying that in the last 20 years,
yes,
we have never been close to perhaps even half of the recommended ratio, which means that this country requires more than 100%, or maybe perhaps 200 or 300% of the health workers that we have. How do we reconcile that to what you just said?
Look, number one, all medical doctors trained in this country are absorbed by the state automatically. That's a policy we run at the Ministry of Health. Number two, the current nursing ratio.
What about those trained by the private medical facilities?
We absorb all.
Okay. So all medical doctors.
All medical doctors.
Yes.
Trained.
Yes.
The current nursing ratio we have now in Ghana means the WHO nurse to patient ratio. So the nursing distribution is way better.
And the ratio is minimum.
Yeah.
The direct minimum.
Yes.
Okay.
The doctor one has not reached the WHO, but the nurse has reached.
But that one has to do with the numbers that we are training, we are producing.
Yes.
Okay.
Doc, and this is the point. Anyone who gets trained, has skills, and sits at home is not the way to go. I, at the ministry, I'm working hard to make sure that whatever we have to say to finance ministry to give us more clearance, we say it so that we can give most of them opportunities. But I want to be honest with the public. Some might not do that. That the numbers of health workers that are being trained from private and public now, if you put all of them in our hospitals, they will even be more than the space. That's one. I also want to be candid that we need more nutrition officers. We need more physiotherapists. We need more of almost every allied health worker. That's why we keep on pushing finance. About 6 weeks ago, we had some clearance for absorbing non-medical staff, doctors and nurses, no other ones. My chief director, Hafiz, together we decided that all should be dedicated to allied health.
My regards to him.
Yes, Doc. So the last clearance we had for absorbing workers who are not nurses or doctors, all have been dedicated to allied health.
You have decided?
Yes, we at the ministry.
How many?
Oh, I think we had just over 2,500 or so.
So when will this be done?
Look, it's a process. Even the nurses that we announced, the 15,000, they've applied on the portal. They are going to interview. It's a process. So I want to
know an election gimmick.
Doc.
September.
Doc, with the nurses, every year clearance is given for nurses, with all due respect, for the past 7 years. So what we are doing is something which happens every year, with all due respect. Unless someone is saying that in an election year we should not give opportunities.
I haven't said that.
Okay, but I'm just making it clear that every year we give opportunities. Doc, if this country, we the leaders, don't engage in honest discussions, we will make noise about a subject only to be given power and we are helpless. I am telling my brother Sami Jemfi that it is true we need more of allied workers. Me, where I sit, I'm doing whatever I can to talk to finance to give more opportunities. But it is very important that we admit the fact that in the public space, assuming you didn't post all allied people, cannot take all of them, we must have an economy that explores and invest in facilities that can give you opportunities. And the figures I've given you here shows that we've employed close to 8,000 allied health workers. What I admit is that the numbers that have been trained might be more or by far, exactly.
Maybe what has been employed will be about 10%.
So the real challenge is not that some are at home. The real challenge is that what can we do?
So what are the incentives that have been put in place for this thing? Because I go around, I see a lot of private sector involvement in healthcare. Yes. A lot. And it keeps expanding. A lot of specialist hospitals, a lot of all these things happening.
Yes. Look, if you talk about incentives, you mean incentives for people to go into that one?
Yeah, if we're saying that that is what must be done.
Yes. But no, with all due respect, you and I, from where you sit, it's not a matter of if that is what can be done. As a nation, that's what we have to be heading towards. Because if you are training a lot of professionals for a particular sector, and your health sector cannot absorb all of them, almost every country, that is how they do it. You must have places that can absorb them as well. But where we started from in the past, from the colonial times, the public sector absorbed all. And there must be frank discussions, like you said, to look at how to encourage people to go into that area.
All right.